Welcome. I am Genevieve Fairbrother. I am one of the physicians at Obstetrics and Gynecology of Atlanta, and I am also the Chief Medical Officer for Atlanta Women's Health Group. Coronavirus COVID-19 is here in Atlanta, and it's probably going to infect a lot of people, more than we realize because we have only had limited testing so far. The goal, of course, in Atlanta is to flatten the curve so that we do not overwhelm the healthcare system. We have put in place some office procedures that will help us take care of our patients throughout this pandemic, but also try to decrease the rate of transmission amongst patients. It comes down to hygiene and social distancing. When you walk up to our office, there is going to be a sign that says patients only. That means no friends, no family, no exceptions. We want to limit as much as possible the number of people coming in and out of our office. You will notice that there's very little paper to be seen. People will be wiping off doorknobs and wiping down counters constantly. We will have hand sanitizer gel available, and our staff will be following a no handshake policy. We are going to do our very best not to have people hold clipboards, use pens, use paper at all. Everything is going to be verbal and typed into the computer that the nurse is holding. When you come in, we expect you to sit in the waiting room for the shortest amount of time possible, hopefully about 6 feet from the next nearest person. We are also going to be only seeing obstetric patients and patients who have gynecologic problems that cannot wait. Annual exams, screening mammograms, screening bone density tests are going to be postponed for at least 6 weeks. To help our patients who we do not want to come into the office or who cannot come into the office, we are going to be using telephone consults. You will be able to schedule a telephone appointment with a physician, and this will be useful for such visits as hormone replacement therapy, menopausal symptoms, anxiety, depression, birth control consults, infertility consults, bladder infections, yeast infections, and the like. We are also going to cancel and reschedule our elective surgeries. These surgeries are going to be rescheduled for at least 6 weeks out. Of course, emergency surgeries, C-sections, ectopic pregnancies, miscarriages will all be taken care of. When you come to the hospital, you'll notice there are some different processes in place. You will be met outside by security and a nurse who will take your temperature and ask some questions. You will be allowed one support person for your entire hospitalization. This is to minimize the number of people coming in and out of the hospital. We are hoping that patients who deliver vaginally will be able to be discharged sooner than 2 days after delivery. And we are hoping that people who undergo C-sections are able to be discharged from the hospital on day 2 or day 3. We are hoping to decrease their exposure to high-risk situations or crowds. Please call our office if you have any questions or concerns. We are happy to help, and we will have excess nurses available to take your phone calls. We appreciate your cooperation in helping this country get through this pandemic and decrease the spread of the virus. Thank you.